If you're a clinician who works with lymphedema, you know that lymphatic ultrasound can be an incredibly powerful tool, but it's often not very standardized, right? Well, a new study from doctors Hara and Mihara is here to change all that. They're proposing a simple, standardized protocol that pretty much anyone familiar with venous ultrasound can pick up and use. Okay, let's dive into this. So here's our game plan. We'll start with the diagnostic challenge, the problem we're trying to solve. Then we'll look at how this new study gives us a reliable map. After that, we'll get into the really practical stuff, the anatomical rules of thumb they discovered, and a super efficient 3-minute screening protocol. And finally, we'll talk about what this new clarity could mean for patient care. All right, so let's set the stage with the core problem. Diagnosing and really getting a good look at lymphedema without invasive procedures can be, well, tricky. And while lymphatic ultrasound, or LU, has shown a ton of promise, its use in the real world has been held back by one big roadblock. There's just no standard way of doing it. Which leads us to the big question the researchers were trying to answer. How do we take all the potential of ultrasound and turn it into a simple, repeatable, and standardized method that actually works for visualizing lymphatic dysfunction? Now, this table really lays it all out, doesn't it? You've got other methods like lymphoscintigraphy or ICG lymphography, but they're invasive. They involve injections, even radiation. They're not always easy to get. Then you have lymphatic ultrasound, completely non-invasive, highly accessible. But look at that last column. There's the catch. That big low under standardization, that's the exact problem this study set out to fix. And this is where the solution comes in, a reliable map, courtesy of the Hara and Mihara study, which was published in Plastic and Reconstructive Surgery Global Open. They basically decided to draw a clear, easy-to-follow guide for the rest of us. So, they've come up with this concept they call SLUS, which stands for Screening Lymphatic Ultrasound. And the goal is beautifully simple. Create a standardized protocol using common, easy-to-find anatomical landmarks so you can find and assess lymphatic vessels quickly and reliably. Okay, now we're getting to the heart of it, the simple, memorable rules that make this whole thing so practical. This is the stuff you can take right into the clinic. We're going to find out exactly where to look and what to look for. The real genius here is that they anchor everything to an anatomical highway that anyone who does venous ultrasounds already knows like the back of their hand, the great saphenous vein, or GSV. By using the GSV as your main roadmap, the hunt for these tiny little lymphatic vessels gets a whole lot easier. All right, so here's rule number 1, and it's super straightforward. When you're scanning the thigh, the study found that the lymphatic vessels are almost always located on the lateral side of the great saphenous vein. And you can see it right here in this simple diagram. Just think of the GSV as your main highway. In the thigh, you're going to find that lymphatic vessel just off the road on the lateral side, sitting right underneath the superficial fascia. It's that predictable. And get this, they even tell you how far to look. On average, the distance was about 17 millimeters lateral to the GSV. So you're not just guessing, you have a very specific zone to focus your search. Okay, so that was the thigh. Now for rule number 2, once you move down to the calf, things flip. The pattern completely reverses. Here, the lymphatic vessels are typically found on the medial side of the GSV. And again, the diagram makes this crystal clear. It's the same highway, the GSV, but now, in the calf, you're looking for that lymphatic vessel on the medial side. So thigh lateral, calf medial. That simple rule is the foundation for this entire screening protocol. Okay, so we know where to find these vessels. Awesome. But the next really critical question for diagnosis is, when is a vessel actually considered abnormally dilated? What's the cutoff? And the study gives us a nice clean number for this. They found that a cutoff value of 0.25 millimeters is the magic number. If the vertical diameter is greater than that, it strongly suggests lymphatic dilation. It's a simple, quantitative measurement you can rely on. So we've got the where to look and the what to look for. Now let's put it all together with the how to do it. We're going to walk through how these rules are combined into a fast, practical, step-by-step screening protocol. So here we go, the whole thing in 5 simple steps. 1. Position the patient and find your landmarks, the SFJ and GSV. 2. Scan the thigh, looking lateral to the GSV. 3. Move down to the calf and scan medial to the GSV. 4. Make sure you've actually found a lymphatic vessel using the DCUPS index. And 5. Measure that diameter. If it's over 0.25 millimeters, you've likely got dilation. And honestly, here's the best part. The researchers report that once you get the hang of it, this entire screening can be done in about 3 minutes per leg. 3 minutes! That's so efficient, it makes it incredibly easy to just build this right into your routine lower extremity exams. Okay, so let's pull all this together. What does this actually mean for you and your patients on a day-to-day basis? What's the real-world impact of having this new clarity in lymphedema care? Here are the key things to take away. First, you've got predictable locations, thigh lateral, calf medial, all based on the GSV. Second, you've got that clear cutoff for dilation at 0.25 millimeters. Third, you have an efficient 3-minute protocol. And when you put it all together, it just simplifies lymphatic ultrasound, which could open up broader access for so many more institutions and patients. And that really leaves us with a pretty exciting final thought. When you have an approach this simple, this standardized, and this non-invasive, could a quick 3-minute scan actually become the new standard for early lymphedema screening and detection? It's definitely something to think about. For those who'd like the original publication information, here is the citation. Shutten, Hisako Hara, Makoto Mihara, establishing a standard method for screening lymphatic ultrasound in lymphedema patients. Plast Reconstruct Surge Globe Open, 2025. 13 E6920. DOI 10.97/GOX 00000006922. And again in English, the source for this explainer is Establishing a Standard Method for Screening Lymphatic Ultrasound in Lymphedema Patients by Dr. Hisako Hara and Dr. Makoto Mihara, published in Plastic and Reconstructive Surgery Global Open. And finally, just a quick note before you go. Please remember that this explainer is for educational, non-commercial purposes only. What we've presented is a summary of one study, so it's not meant to be a universal clinical guideline. Also, all the diagrams you saw were original concepts we made just to help illustrate the points. So please always cite the original paper in any clinical or academic discussion. And because of the source materials license, we don't recommend monetizing any content you create based on this. Thanks so much for watching.